Hello, my name is Michael. I'm a mental health practitioner student, and your name is Tatiana.
Yes.
May I address you by Tatiana?
Yes.
Thank you. I'm going to be performing a mental status exam on you today, and I'm going to be going over some depression questions at the end.
Okay.
Is that okay?
Yes.
All right. First question I'm going to ask is, well, it's not a question. I'm observing the patient's appearance. It's more an objective data, so I am just seeing if she's dressed appropriately for the visit, which she is. I'm assessing her grooming. I'm assessing if she's performed hygiene, and to see if she's disheveled or bedraggled. And she is dressed for the visit, and that doesn't seem to be a concern at this time. Next, we're going to look at her behavior, and we're going to see if the patient is calm, and appropriate, no anxiety or aggression or anything for the visit, and if she's just compliant and being here for the visit. And that's another objective data that we'll be assessing. And then the third one would be attitude. Again, this is more objective data that we're obtaining, the practitioner is obtaining from the patient, and we are checking to see if the patient's cooperative, if they're hostile, if she's guarded in any way, and if she's engaging in the visit. And then 4, we're going to check the level of consciousness and see if the patient's alert, if the patient's lethargic, is she stuporous. Again, this is more objective data. And next, orientation. Finally, we get to some subjective data. I will assess the patient's level of orientation and ask her where she is. Do you know where you're at?
Yes.
And what's your name?
Tatiana.
Thank you. And what's today's date?
December 8th.
All right. And what day of the week is it?
Sunday.
All right. Thank you. She is fully oriented to person, name, person, and place, and time. So that's our first subjective data that we're getting from the patient, and obviously we're getting objective data as well. Next, we're going to go to speech, and this whole time, again, it's more objective data that we're getting this whole time. I'm assessing the patient's speech, her rhythm, her rate, seeing if her speech is pressured in any way, and you can learn a lot from a patient's speech pattern. Next, we're going to go to, I don't want to look at the form, but I'm going to check, it's mood, I believe. Yep. We're going to go to mood, and we're going to assess the patient, and this is more of objective data, and you're going to see if the patient is happy or sad, and this goes upon the assessment. And next, we're going to move over to the affect of the patient, and we're going to see if that's congruent to her mood, which it's again more objective data that we're obtaining, and we're going to see if the patient's her affect is if she's got a flat affect, or is it concrete, or if it's flat, and just making sure that her affect is matching her mood, and which could tell a lot, because if the affect is not matching the mood, then that will tell you that the patient is possibly decompensating in some way. Next, we're going to move on to thought process and see if the patient is thinking correctly, if her speech, her thought process is disorganized, or if it's concrete, or if she's got a good thought process going. And then at this moment, I'm gonna ask her to remember 3 items. That way I can assess her memory later on the exam So these three items I'm going to ask her to remember are, can you remember key, tree, and cat?
Cat, key, and tree.
Okay? And I will I'll ask you for those items again. Next, we're going to go to thought content. And that is going to assess patient if she is actively in psychosis, maybe if she's experiencing hallucinations, visual or auditory hallucinations, if she's paranoid or if she's psychotic, or if she's paranoid or if she's delusional. Next, we're going to assess the patient's if she's got suicidal or homicidal ideation. Do you feel like you're harming? Do you feel like you want to harm yourself?
No.
Do you want to harm anyone else?
No.
Okay. And that was a no to both of those. Next, we're going to check the patient's insight and judgment to her mental illness and see if she is aware of her mental problems and if she is compliant in her medication regimen. That's another assessment, whether the patient has good insight to her medical problems, psychiatric problems as well. And then next, we're going to move on to attention span. Now, on this area, we can assess the patient's attention span by, there's a couple of ways. Now, I'm going to ask the patient to perform an exam where we would be able to measure if she is thinking correctly or if she's got a good attention. So I'm going to ask her to count, subtract by 7 from 100 and see if you can do that.
100,
Yeah.
93,
Mhm.
86,
Yep.
79, 65.
All right, thank you very
58.
much. And she was able to perform that without any problems. So 14, now we're at memory, and I'm going to ask you to recall those three items that I asked you that I mentioned earlier.
Cat, key, tree.
Yeah, and she got all three of those correct. So again, if this was an actual mental status exam, I would probably mention those items at the beginning of the assessment to see if the patient was able to recall those items, and she was clearly able to do this at this scenario. And then finally, we're going to do some intellectual functioning. I'm going to assess a patient by asking her, assessing her abstract thinking, and see if she's able to abstractly respond to the question that I present. Can you tell me why are a fruit and apple, why are they alike? A fruit? No, not fruit, I'm sorry. An orange and apple.
They're both fruits.
She got that correct. All right. So that completes our mental status exam. And we went through 15 areas of the mental status examination. All right, next I'm going to go through some questionnaires as far as depression. And first I'm going to question the patient on the PHQ-2 exam. And this is two questions, the PQ2 exam. And then if these questions were positive, then we would move over onto the PHQ9 exam. But we're going to do both and touch base on both of these questions, on all of these questions. First, the first question: over the past 2 weeks, how often have you been bothered by any of the following problems? Number 1, little interest or pleasure in doing things. Any problems with that in the past 2 weeks?
No, none.
So I would rate the patient at a 0. She would get a 0 for that. Now, she said, yes, I've been having problems every day, nearly every day. she would be rated at a 3. So, and then thereon you got 0, 1, 2, and 3. Second question: feeling in the past 2 weeks, have you been feeling down, depressed, or hopeless?
No.
All right, she answered no, so I'm rating her at a 0. And then again, it goes from 0 to 3. And then next, we're going to go over to the PHQ-9. And they have 9 questions here. The first 2 questions we just went through. And then I'll ask her number 3, which is, have you had trouble falling asleep, staying asleep, or sleeping too much?
No.
All right. 4, feeling tired or having little energy?
No.
All right. Number 5, poor interest, poor appetite, or overeating?
No.
Number 6, feeling bad about yourself or that you're a failure or have let yourself or your family down?
No.
All right. And then number 7, trouble concentrating on things such as reading the newspaper or watching television?
No.
And then number 8, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual?
No.
And then number 9, thoughts that you would be better off dead or of hurting yourself in some way?
No.
All right, she answered no to all those questions. And again, there's a rating system, a scoring system for this. Not at all is a 0. Several days is a 1. More than half the days is a 2. And then nearly every day is a 3. And that concludes our mental status exam. Thank you.